So today we're going to be talking about trauma, stressor disorders. Trauma. So this is a category of disorders that includes post-traumatic stress disorder, adjustment disorders, and attachment disorders. So, post-traumatic stress disorder is abbreviated PTSD. It's the result of an external traumatic event in one's life. This can range from auto accidents to sexual abuse to violence. Oftentimes you'll see this in the military because of the trauma that soldiers are exposed to on the battlefield. Many describe it as the event that you can't stop remembering. The changes in the brain, the result of this traumatic event, are both psychological and biological. It puts people in a near constant state of fight or flight, and when people are reminded of the incident, these chemicals are raised, and then they're kind of put in this constant state, and over time that does damage. So, symptoms that are common in PTSD include flashbacks of the event, emotional disconnection, jumpiness, etc. Treatment for PTSD includes cognitive psychotherapy, in which counselors help those who are traumatized to work through those thoughts and emotions. One example of this is exposure therapy, which is incrementally bringing back those cues, those memories that trigger the thoughts of the event, so that they can build up a tolerance to that. Medication is also prescribed that works similarly to antidepressants. Recent research has shown that 3 factors are necessary for PTSD to develop. So some people that get PTSD have risk factors already, and then also you have to have the traumatic event, obviously, and then thirdly is the changes the brain has to make for PTSD to develop. And so knowing these 3 things, we can work to prevent it before those brain changes happen, and knowing the direction those brain changes take, hopefully treatment can reverse those changes and be able to see that more accurately. That's PTSD. So we're going to insert that post-traumatic stress disorder right there, and then we'll move on to adjustment disorders. So what is an adjustment disorder? It's defined by a short-term condition that occurs when a person has great difficulty coping with or adjusting to a particular source of stress, such as a major life change, some kind of loss, or a big event. Symptoms include emotional sadness, hopelessness, really a lack of enjoyment, crying spells, difficulty concentration, feeling overwhelmed, thoughts of suicide, and otherwise. Treatments include psychotherapy, medications like antidepressants and anti-anxiety medication. What you're going to find with a lot of these medications is that they really don't address the cause. They're just unable to do that. If we could do that, well, it'd be $1 million industry. Well, I guess it already is $1 million industry. Probably billions of dollars. Anyway, it's really just addressing the symptoms. Like, we can reduce anxiety, but not really going to address the underlying causes. It's going to take a lot more work, like in the psychotherapy. So, current research findings are showing that interview-defined expression and anxiety is less common in patients with cancer than previously thought. Some combination of mood disorders occur in 30 to 40% of patients in hospital settings, without a significant difference between palliative care and non-palliative care settings. So really it's just showing that there's a high likelihood of developing some kind of mood disorder by being hospitalized. Well, maybe it is the reason that one becomes hospitalized. So here we got 7. Last one was 6. Defined. Attachment disorders. What is attachment disorders? A disorder of mood, behavior, and social relationships arising from a failure to form normal attachments in early childhood. Symptoms: an aversion to touch and physical affection, control issues, anger problems, difficulty showing genuine care, an affection, and maybe an undeveloped conscience. Treatment: family therapy, play therapy. As is really common with a lot of kids, play therapy does end up being very effective, but it's a lot more specific depending on the child and their condition. Got parenting skill classes. The current research findings is that insecurity with both parents, that really has a severe impact on children with attachment disorders. Double insecure children were reported more overall problems were rated by teachers as having more externalizing problems than those with at least one insecure parent. Obviously, if you have more insecurity in your life, it's probably going to manifest itself that way. Security with either parent could offset such risks, and working with parents, same thing in this family therapy, is really going to help children with overcoming this disorder. So that's all of the trauma stressor disorders, and thanks for watching. Join us next time.